Curiosity Corner with Dr. Sarah and Dr. David. So Dr. David,
Yes.
I'm curious.
That's typically how we start, right?
Yeah.
You're usually curious about something. I like
Yeah.
this. It's a good motto. Yep.
So my uncle has been having shoulder pain about 4 months, and every time I see him, he's not interested in doing anything about it until he gets an MRI. So what is your response when you get a patient who's just insistent that they need an MRI before anything can help?
Awesome. I'm glad you're curious about it. Good question. I will say I probably get this question on every shoulder evaluation I have. And if they don't ask it, I will actually bring it up. Because I think a lot of people are, no pun intended, but are curious about it. I think MRI provides a couple things. It provides peace of mind, right? It assists in the diagnosis of what's going on. But there's also downsides to it, right? And we'll kind of delve into that a little bit more, right? So if your uncle came to see me, right, 4-month history of shoulder pain, the first question I would ask is, how did it start, right? And so I think as physical therapists, we do things really well, okay? And we're really good at listening to our patients and treating them kind of based upon what they tell us, right? So when I have a shoulder patient in front of me and their pain typically comes on or they don't really know how it started, we want to break them down in 2 different buckets, right? So shoulder pain is usually traumatic or it happens over time. So let's say your uncle went snowboarding and fell down the hill and dislocated his shoulder and then he couldn't move his arm. MRI would be probably a good place to start, right? It's an emergent situation. You don't know if it's the entirety of that shoulder, if he can use it whatsoever. It happened as a result of trauma. Majority of patients that I see in physical therapy are what we call atraumatic, completely separate bucket, okay? And we break that down from a trauma is typically structural. There is a rupture, the joint has dislocated. If you have a 4-month history of pain and it just kind of slowly happened, we call that more mechanical. Right? It means that there's probably too much stress in a certain area that is creating a pain experience, okay? So for someone that has a 4-month history of pain that's happened over time, I would want to know what makes it better, what makes it worse, right? What are the patterns for it? And as a physical therapist, our job would be to say, okay, why did that pain come on? What are things that we can influence that would make that pain better, right? And so the question back to your uncle would say, based upon the assessment, and you might have weakness, right? You might have limitations, right? You might have postural abnormalities or imbalances between muscle groups that are probably contributing to their pain. I would say, would an MRI change how I would treat your uncle based upon things that we can control? Probably not, right? Because the MRI is one snapshot in time, right? And so let's say your uncle may be over the age of 50. You MRI a shoulder that's had 50 years of use activities on it, he may have a rotator cuff tear. But that rotator cuff tear might have been there 5 months ago, might have been there a year ago, and it wasn't painful. Right? And so the positive of MRI is it can tell you what's going on. The negative of MRI, right, which typically does not lead to better results, is that it might find something that really doesn't correlate to your pain. Because if your uncle came to me 4-month history of shoulder pain, I'd be able to take care of him in physical therapy, doing what we do with hands-on treatment. If it's weak, make it stronger. If it's tight, stretch it out, irregardless of kind of what's going on the inside. So for someone that is atraumatic, if pain just kind of slowly came on, they might be trying to exercise and it hurts, we would treat them without an MRI and we would do it very efficiently because it's not going to change the course of treatment. Does that make sense? Where it's like trauma versus not trauma. The majority of the time we see people in the clinic, it just happens over time. Treat them effectively without it. Right?
And like you said, I know I've read it in the past too, 35 to 40% of all age groups have a rotator cuff tear, but no pain, no symptoms. I like reminding my patients that again, you can see things on imaging, but it doesn't mean that that's what's causing your pain. And even over the age of 70, 2 out of 3 people have a rotator cuff tear, but no pain or symptoms. So again, even if at the moment, maybe your pain is coming from that rotator cuff tear. Do 100%. I need surgery? Not necessarily, right? If we can get back to being pain-free, strong, and mobile, you might never feel that shoulder again down the road, right?
That's the epitome of that downside. Because the MRI, let's say your uncle went to have one and it showed a rotator cuff tear. What does his mind start to think? Do I need surgery? Am I going to be able to use my arm? You're going to naturally feel weaker if you know inside you have an injury. So 100%, my advice for patients is to kind of figure out the root cause. Why is that pain there? What can you influence without the need to... And MRIs aren't cheap, right?
Right, they're expensive.
Right? And so if it's not going to change how I'm going to treat you, I would say let's do it without it. And if we need to, right? Because there is sometimes cases for an MRI being warranted.
Yeah.
Right?
When would you say you think an MRI is appropriate?
So one, if it's the traumatic experience, right?
Mm-hmm.
If I go hang gliding, and I don't go hang gliding often, but if I did and fell,
Yeah.
right, and I dislocated my shoulder, I'd probably want an MRI,
Yeah.
right? Apart from that, I really don't want one because, like you said, it leads to pretty negative outcomes,
Yeah.
right? From a fear standpoint. If I had a patient in front of me and I was like, hey, they're not getting better, and there's a progression of loss of strength or a change in their neurological symptoms, they're not using their arm as much, or you see kind of new atrophy, the muscle is wasting away, I would want to know why that's there, because that's going to change my course of treatment.
Yeah.
Right? And so if I have someone in front of me that their muscle is atrophying or being injured over time without a known cause, I would need to change my treatment. So I would refer them out to a specialist that would be able to kind of denote the reason why from an MRI or further imaging.
Yeah.
Right? But that's a very rare case. And we would save that for, pretty specific red flags.
Yeah, that makes sense. The one other thing I'd add to that too, every now and then you get that patient who says, oh, I've got this night pain. My mom says it's probably cancer, right? Because you hear about night pain and cancer, I probably should get it imaged. But now we know a lot more about nerves and how nerves behave. And we know that nerves like movement and blood flow.
Mm-hmm.
So sometimes when you go to sleep and your blood pressure goes down at night, that pain starts throbbing a little bit more. And that's all that means, right? So
100%.
again, most of the time that MRI is not the first step. Because even when you get the MRI, the doctor's going to tell you, well, go try therapy. So we're not going to skip that.
That's why I think we're
Go try
biased.
therapy.
I think if you come to us and you're experiencing shoulder pain, the number one thing we're going to do is listen, right? Because that's really going to dictate your treatment and your plan of care.
Mm-hmm.
And then we're going to investigate. Like, what if we reproduce that pain that you have at night from a muscle standpoint? We can treat that.
Yeah.
Right? And so that kind of calms that fear or that worry about that. We can kind of put you at ease and make you feel better without needing to get an MRI, without the thought of surgery, without the aspect of an injection or something like that, right? So if you have an issue with your shoulder and you're curious, bring that back, right?
Yeah.
If you're curious about getting an MRI, give us a call, right?
Yeah.
Leave a comment and let us know.
Come see Dr. David, our shoulder specialist. He can definitely help you out.
Perfect. Have a good one.